Dr. Moczygemba with Direct Med Clinic. We're seeing a lot of cases of COVID these days. It continues to amaze me how subtly this disease presents itself, and that naturally puts people in a kind of a state of denial because they feel like, oh, I'm just sore because I overexerted the other day or had a good workout at the gym or I was moving some furniture around the house. Or they think that, oh, it's just my allergies have flared up and that's why I'm feeling this way. Or they might think, oh, this is just a cold, it's pretty mild, no need to worry, I think I'm going to be fine. So that's how a lot of this presents. And then all of a sudden, like around day 5, they're like, ooh, I'm feeling pretty bad. So I came across a slide chart I want to share with you guys that will explain my approach and the approach that we take at Direct Med Clinic of prevention, early detection, and aggressive treatment. And we do this, you'll see why when I show you this chart. The main reason is to try to catch this early before it gets out of hand and people have to go to the hospital. Okay, so that being said, let me just remind everybody that each doctor has their own approach to treating patients with COVID, and that's a personal thing between you and your doctor, and I don't want to get in between that. So that being said, let's take a look at this slide. As we can see on the horizontal axis, we have the time course in days of the disease, and then on the left side, the vertical axis, we have the severity of the disease. So let's look at days 1 to 5. The dotted line represents the severity of illness. So from 1 to 5, you might not even know that you have it, but look at what's happening in your body with the virus. It's replicating and replicating. So it's growing in your body, making more and more copies of itself and spreading throughout your body. So it's not until like day 5 that people typically start to even know that they have it. That's when they get symptomatic. But look, it's at its peak of replication at that point. So if your symptoms are mild, and most of the time they still are, between days 5 and 7, 10, people are in that little stage of denial that I talked about. Well, like it's not too bad. I'm just gonna give it some time and I'm gonna take some over-the-counter medicine. So you're letting the virus then replicate itself and even spread more throughout your body. So then we also note that viral replication ends around day 10. This is why the CDC guidelines say that you need to be in self-isolation for 10 days after you become symptomatic, because after the 10 days the virus isn't replicating and you're not shedding it, or in other words, you're not contagious anymore. Then if we look at where the viral debris starts, that continues. That's ramping up at this stage of the disease, and that's why a lot of people can continue to have a positive test even after the disease has run its course, and they feel good, but they go and get tested, and these tests will come back positive for weeks and months after they get better. And this is why the CDC did away with the return to work, the negative test return to work guideline. So now let's look at what happens after about day 10 or 11. The virus stops replicating, but the disease changes phases. It goes into what they call the pulmonary phase. So that's where the shortness of breath, starts to get worse. And the reason it does is because we can see by that orange triangle that's when our immune system is ramping up to fight the virus. But the virus is already done replicating. It's reacting in effect to the viral debris or the dead virus in our body. And as time goes on, the immune system gets stronger and stronger to fight what it thinks is the real disease, and that's what causes the hypoxia or shortness of breath. And that progresses, and even after day 14, it gets significantly worse, as we can see how the severity goes up. So there's a need to pay attention to the symptoms, your exposure history, what kind of symptoms you're having, getting tested and talking to a doctor early. I hope this makes sense, and especially if you or your loved ones have a risk factor, don't roll the dice. Just see your doctor early and tell them, hey, look, I've got this and that, or go get a test. But don't rely on a negative test to think that you're going to be fine. I would recommend that you talk to a doctor. Okay, so I'm going to put a link to this information here along with this little talk that I'm doing. So if you want to go take a look at some more where this research came from, you can. And I hope that this is helpful. If you are an employer, just know that through our direct primary care model, we contract directly with employers, and we help them and their employees make sense of all of the stuff that's going on with COVID around us. We do go out and we do testing as well. If you're an individual, just know that Direct Med Clinic, through our direct primary care model, we contract directly with you instead of with the insurance company. So we give you access to us, and we're with access, that's exactly what you need to try to catch COVID early and prevent it as much as possible. Okay, so I hope that makes sense. This is Dr. Roger with Direct Med Clinic.